All right, so let's dive now into a very large topic. So really, I can promise, we're just going to touch on this, but I want to talk about chronic inflammation and cancer. So this is really a terrain issue, right? So there's this sort of new emerging theory about cancer that it's not just a mutation in this bad group of cells that get badder and badder as they get bigger and bigger, but that there's a co-optation of the environment and there's an interplay between the stroma and the cancer cells. With that backdrop, I want you to talk a little bit about how you measure stromal inflammation and what you find to be the most, well, I guess maybe first just add your thoughts to the relationship between stromal inflammation and carcinogenesis, and then talk a little bit about how you measure it.
So what we're doing, the piece we're doing that the conventional oncology is not doing, is looking at the tumor microenvironment. We're looking at the terrain, and that's why we have such a big impact. And so patients do better because of that. So the metaphor I use for patients is, you know, the soil in the garden influences the health of those plants and what happens to them, whether they're diseased or not. So patients get that, and so should we, right? So inflammation is in that milieu. What a lot of general practitioners, I think, don't understand is, number one, that milieu of inflammation itself is a setup for damage to the DNA, right? Damage to the mitochondrial function, damage to signaling, to binding, right? Inflammation aberrations have those impacts. But also the presence of tumor cells themselves produce a lot of cytokines and chemokines. So we have this hot soup going on, right?